gun violence is up 30% in the U.S.
The pandemic has played a major role. Jeremiah Marshall joins us in the studio with more on that tonight. Jeremiah.
Yeah, Alicia, Valerie, that's all according to Penn State professors who predicted that gun violence would rise during the pandemic. Tonight, they're sharing the results of their research. Penn State College of Medicine says there are many factors why gun violence went up during the COVID-19 pandemic. Factors include stay-at-home orders, isolation, social disruption, and more people able to get their hands on guns.
One important point is that we do not pit one public health crisis against another. We need to instead put more emphasis on both issues at hand.
Anna Sintongo, assistant professor of surgery and public health sciences, says gun violence has been a strong issue during natural disasters, epidemics, to even now a global pandemic.
Public health preparedness and disaster relief efforts should consider both the initial crisis and the downstream effects from the crisis, such as plausible increase in violence and moreover in gun violence.
Educators say it's important for public health officials not to just prepare for initial crisis, but the long-term effects it can leave behind, like how the pandemic has caused challenges with limited resources like beds and supplies.
Space is an issue, and our hospital does get full, especially with COVID-19 cases, and then gun violence on top of that. It's kind of like a pandemic on top of a pandemic.
And researchers also say if gun violence continues to rise, that can stress the health system even more. In studio, Jeremiah Marshall, ABC 27 News.